on the camera, so I'm not going to use a mic for the room because I think that I'm already loud enough. I'll hear what I have to say. All right, so the plan today is to give you a big picture of the overall sort of research questions that are engaged with the social networks, a taste of what social network analysis is like, and we're going to finish the day by talking about actual R coding and making software work. So my task today is to sort of encapsulate both you got a bunch of substantive questions earlier today, and now my job is to try to give you the big 30,000-foot view of what is social networks in health and why would we care about it, right? So the way that's going to work is we're going to talk about this big picture. I'm going to talk about what I think are the main elements of networks and why we care about them. That is, how do they actually function in a sociological model? And then really put it directly to some of the pieces that are happening here. I always start, I'm afraid to go back and look through my history of PowerPoints, but I probably started every talk I've ever given with this slide, which is to say that to speak of social life is to speak of the association between people, and their association in work and in play, in love and in war, to trade or to worship, to help or to hinder. It is in the social relations been established that their interests find expression and their desires become realized. This is what I call the strong program in social network analysis, for those of you that know sort of like the ACT kind of world. That is what it means to be a person, a who as opposed to a what, is to be related to others, right? So a person is somebody who's connected to somebody else. A what is a balding white male who should have cut his hair years ago, right? So that's a what, right? You know, a who is a wife, a teacher, a lover, right? These are the kinds of things that make a who. It's the connections you have with other people. And what social network analysis is designed to do is to provide a way for us to capture that distinction, not just of the whats, which we're really good at doing, but the who's, the connections, the intersections of people and their relations with others. And so we think about this process both as a substantive idea from Blau, but also I think from a predictive problem, right? And this is the notion that Moreno gave when he talks about this vast solar system, this vast structure of this vast system of intangible structures affecting conduct as gravitation does in space. This is the promise of social network analysis. That is, that these connections between people are somewhat invisible. We're not always aware of them, certainly not as outsiders looking into another community, but even often sort of internally we're not aware of sort of the connections around us. But if we were, right, if we knew what these relationships were, we might be able to leverage them in various ways. And just as, you know, astrophysicists are able to predict where a black hole is going to be 6 months from now, we can figure out whether or not we can change smoking in a village by changing the amount of behaviors we give to someone else. That's the idea, right? That's the promise. Now, it might be a bit grandiose, like Moreno was frankly crazy, right? So it's not clear that we want to like put too much weight on this, but that's the idea, right? That we have these structures, they're important for what it means to be a person, and if we can only map them and measure them, make sense of them, we can do something good with it. And the beauty of this idea is that a lot of people have sort of thought of it, right? So that since the 1930s, this has been growing dramatically, of course. Not only that, but since the 1990s, it's been a rapid growth. This is the proportion of all papers on networks and health as a proportion of all papers on health. It's currently about 5% of all papers on health indexed in the Web of Science are also on networks. Now, 5% isn't a big number, but obesity is about the same, right? So this is a fairly large number of papers being done. It's something like 5,000 papers alone, 6,000 papers alone in 2018. Right, so there's a lot of work going on in this. More important for those of us that are trying to get our careers going, there's a lot of money in this as well, right? So NIH, NSF, DOD, DOE have funded these works a lot, and they're continuing to fund this work. And so it's not a bad option if you're trying to place your bet on where that K award might hit or where you should go for your next grant, to at least throw a buzzword or a sociogram in there and see if you can get that done. What we're hoping is you can do a little more than that today, right? Over the course of this week, we're going to try to put you to a point where you can actually do a little bit of what Moreno said and a lot of what Blau said, right? And so I'm going to steal a bit from Kathy. Actually, to be quite frank, she stole it from me. The idea is that, you think about what a high school is, right? So you might think of a curriculum, you might think of buildings, you might think of palm trees. I grew up with mountains, so that's a new idea. When I think of a high school, I think of this, right? So this is a high school, and high schools are these connections of people with each other. You're going to see a bunch of these images over the week, and I'm actually going to teach you how to make them. But the thing that matters is that the X and Y axis is irrelevant. What matters is proximity, right? So two nodes that are close together are either friends with each other or have lots of friends in common. Two nodes that are far apart tend not to be friends with each other and tend not to have many friends in common. This is the best 2D projection of the n-dimensional space that you have in a network, right? And so it's not a perfect fit. So you get some people that you get these lines all the way across. If I could display this in n-1 dimensions, that would fit perfectly, and that sentence would be true, but you can't, right? So this is the best you can do. And as you would expect, right, it matches on what we would expect in something like a school. The junior high's up here with the 7th graders and 8th graders. They make friends with the 9th graders. The juniors and sophomores are mixed together, and the seniors are kind of off on their own at the front. And as we saw before, like this school is actually divided in 2 ways. It's divided by grade and by race, right? And what's interesting about the AdHealth collection of 120 some odd schools is that in some settings where they're mixed race, they look like this. In other settings where they're mixed race, they look entirely integrated, right? And so the distinction between what drives a nominally integrated school from a socially integrated school is substantively really interesting, and it's something we want to be able to make sense of and understand, and you couldn't do it if you didn't have these kinds of data. So this is the idea that social networks let you see things that you wouldn't otherwise see. If I were just an administrator looking at my school count, I'd say, done, check, 50% black, 50% white, I can go home. Right? But if you go into the lunchroom of this school, you're going to find that the black kids are not sitting with the white kids, and there's a lot of social tension probably going on between these sets. And what we hope to do with social network analysis is figure out that distinction between the nominal sets of integration, the what distribution in schools versus the who distribution in schools. Right? But to do that, we need some techniques. We need some analysis skills. And I stole this quote from Lynn Freeman, and it's now pushing on 40 years old, but I think it's sadly still almost as true as it used to be, which is to say for the last, now I'm going to say 90 years, empirical social research has been dominated by the sample survey, but is usually practiced, the survey is a sociological meat grinder, tearing the individual from a social context and guaranteeing that nobody in the study interacts with anybody else in it. For those of you who don't like the colloquialism of meat grinder, this is the IID assumption. Right? We take all of our cases as identically and independently distributed. There's no connections between them. If there is a connection between them, that's an error that we're going to expunge like sin, right? I mean, it's not something that's good. We want to get rid of it. We want to purify it, throw some methodological holy water on it, and it'll go away. Instead, what we want to do is to say that that's not sin, that's not bad. That is what makes social life interesting and useful and great. And so we want to be able to capture it, model it, and do something with it that is substantively interesting. And that's what social network analysis is designed to do. It provides a set of tools to empirically extend this theoretical understanding we have that patterns encompass what social life is all about. So to put up a few points about what social network analysis is, right? It's a set of relational methods for systematically understanding and identifying the connections among actors. It's motivated by this structural intuition based on ties linking actors. It's grounded in systematic data. It's a largely mathematical set of tools. It's basically applied graph theory. It uses a lot of these kind of graphical imageries. It's not accidental that we're trying to make the invisible visible in a world like that. These sort of sociograms and visualizations help a lot. And so the goal is to go through all of those types of tools because by and large, you are all trained on the IID catechism about how to do those kinds of models, and this is hearsay. And so what we need to do is undo some of those kinds of thinking, give you some new tools, and help you figure out how to get to that point. And that's what the rest of this week is going to be game to do. In this context in particular, the reason we care about this is because of this rise in an understanding that health is largely socially determined, right? So the social determinants of health framework has as its sort of primary understanding that social context determines health as much, if not more, than the kinds of kinds of things a person is. And the main element that the social network sort of world fits in is this idea of social position. And we can think about social positions as being, a teacher or a leader or something like this, but there's this notion of being a particular position in a network that we want to think about in particular. There's another side of the social determinants of health that gets a little bit less play. Now, this has come up a lot in some of Christakis and Fowler's work, and I think is arguably going to be the next 20 or 30 years of social network research, which is what I would call the spillover effects. Right? We've invested a lot into thinking about how the treatment we give to a patient will help that patient. Right? That's what we're trying to do to that patient. But the beauty is that that patient has friends, colleagues, and countrymen, and those friends, colleagues, and countrymen are the kinds of folks that the things that we do for them, they might also do for those folks, right? So there's a spillover effect that when I invest in helping one person get healthy, right, that healthy behavior spreads to their friends, which makes them healthy even if I didn't spread to them. So there's a way, if we're careful about how we think about this potentially, to invest in particular individuals and how we treat them or sort of help them get better that will not just help them, but will help everyone connected to them, right? Now, of course, the sad part is if I'm going to make this claim that a spillover effect matters on the positive, it probably also matters on the negative, right? So you have to be careful, right? What's good for the goose is good for the gander, and if I'm doing something that's helping someone and doing a good job with that, the flip side is if I'm doing something poorly, that's probably also hurting the rest of the community. So things like medical mistrust, for example, probably spread pretty strongly through networks if we're not careful about how we engage trust in the universe of the participants we play with. All right. So that's a big framing about the why. Why would we care about this stuff? And what I want to do now is move on to what's going on to it. I talk really fast, right? And so I have a basic rule, which is that you can't stop me, right, from barreling ahead. That's just kind of in my nature, but you should try, right? So if there's any sense that, like, any moment you have a question or thought, just jump in. I'll try to stop for a moment and ask. But if there's any questions or comments, please raise them. Comments, questions, concerns? All right, awesome. So I like to break the history of social network research into sort of three basic phases, right? Sort of an early and middle period and a late period. And what's fun about this is back in the 30s when Moreno and those guys were doing their crazy stuff. Then there was this golden period in the 60s and 70s where sort of lots of the ideas and tools we think about now came to be, right? And then there's the current period where it's gone off. And I hate to break it to us, but it keeps going up, right? This seems to be an exponential curve, which, knock on wood, hasn't gone away completely yet. And so I'm going to go through some of these pieces. I'm not going to go all the way back to the beginning. I'm going to start sort of in this golden age in the middle. But I want to sort of hit sort of a highlight reel of where the social networks and health field came from, some of the seeds that planted that started this way of thinking, before we get into some of the tools and ideas that drive the work that comes from that. And so we can go back to the 1960s, right, for a set of work. One of the early pieces that is really important in the social determinants of health literature, but also in the networks, is Rosenberg's piece on the society and the adolescent self-image. This piece is famous for its notion of self-esteem. It sort of generated all these studies about self-esteem. But the real thing that this study that I think that is important for us is it really highlighted the adolescent social self-esteem as a function of the context they lived in, right? And so it's sort of keyed up this idea that what makes a person's self-image sort of matter is a reflection of the people they're next to. And so again, it was this notion that a person's not a person by themselves, they're a reflection of the community they move in. The big piece for us that's going to come up later is this notion of the diffusion of innovations. Roger's piece is a seminal work in asking how an innovation, how a new idea, once it's dropped into a community, spreads throughout the set. And what Roger's provided us with were a set of tools for looking at this largely at the macro level. Right, so what is it if I look at it with these sort of sinusoidal curves about how it is, see something sort of take off slowly, then it picks up speed, it picks up a lot of speed, it goes through a growth phase, then it starts to level off and decline. And this notion of a growth curve that goes through a population maps on nicely to the spread of something through a field. And this work was first done in the 1965, if I remember correctly. The book's been in 4 editions. It provides a beautiful mathematical model for the aggregate distribution of these things, and it's really a nice piece. Underlying all those aggregate contact models is a network process, and his premier probably student is Tom Valente, and we're going to get to his work in a moment. In the mid-70s, Denise Kendall came up with this paper on homophily and smoking. It's a really wonderful paper, and I put this paper out here for a couple of reasons. One is because it was one of these early pieces about adolescent socialization and peer influence and so forth, but it's also one of the first pieces to talk about this distinction between selection or influence, right? So there was a lot of work early done where you'd ask, well, how many of your friends smoke? A bunch of them smoke, and we call that good, but there wasn't a huge understanding of the idea that people who would smoke would also be sort of shunted off to a corner. I went to this tiny little high school in Montana. We literally had an island in the parking lot where kids were allowed to smoke. And they probably stayed friends with each other, right? We literally called it Smoker's Island, and that's where the kids went. And if you did a network study of that, like kids who smoked were friends with each other because that was the only place they could be at lunchtime, right? It didn't matter if they liked each other. And so the idea that there was a distinction between selection or influence was largely ignored before this work came into being. Now the work's been beat to death, quite frankly. It's a boring question. We're gonna deal with it, but there is selection and influence undoubtedly. But it's a question that's been around for a long time, and we need to be sensitive to the way this question works. There's been a lot of work on the social support idea and health, and probably one of the earliest work that's coming out of this is Berkman's stuff on this American Journal of Epidemiology paper. That shows that people's social ties actually created improvements in long-term mortality. Right, so this is a really interesting finding. It's not just that I feel better about myself, right? That I look around and see all my friends are unhealthy, so I must be healthy, right? It's not a reflection problem. This is actually in a longitudinal follow-up. People who have greater social support live longer, right? That's kind of cool. That's a good thing. The academics are isolating me, worries about that, but I do my best. In the 90s, is where you see that big peak in this sort of what I call in the third phase of the growth of social network analysis. And this was driven in large part by fears around HIV and AIDS. And it generated this huge amount of work coming out of what I'm going to call the connectionist model of social networks and influence, where the question is, what is it about a structure of a network that's going to impede or facilitate the spread of something, of a disease, through that network? And this was a movement away from classic models from epidemiology, which are compartmental models, which work with the kinds of bugs where if I sneeze in this room, unfortunately, you all get my disease, right? The beauty of that model, frankly, is that it's really pretty straightforward to model. I can deal with some mean field equations where I understand the probability of a few joint items happening, and it works really nicely. The problem is when you have something like an STD, HIV, or any other kind of sort of close contact contagion model, that type of general mean field equation just simply doesn't work. Right? The specificity of contact is such that you need to understand not just what the bug is doing in host, but how those hosts connect to each other. And the process of making those connections are the pieces that create a network. Right? And so the fear, and it was a massive fear in the late 80s, early 90s about where HIV was going, generated a huge investment in money and research on social networks, which has had, not surprisingly, interesting spillover effects outside of the HIV world. Right? So we learned a lot of new tools and techniques from modeling networks that came out of this work. And Rich Rothenberg and John Potteritt were some of the main players in that. Just as a preview, Rich Rothenberg is our keynote speaker that's going to wrap up this conference this week. He's going to talk about his version of this history, which is probably going to show that everything I'm telling you today is wrong, but we'll see where that goes. For those of you coming from the public health world and have thought about social influence and social support, James House's work on social support is probably the touchstone piece. This is arguably one of the most cited papers of all time in the field. And this is a review piece that really goes through and talks about how all across lots of different contexts and lots of different spaces, the social relationships we have with people bolster our health, both biologically, mentally, and socially. This work has been taken from the individual level, that is, if I have social ties, does it make me healthy, to the community level in the work of Bernice Pescasolido in a somewhat ironic way, looking at mental health. And here we're building directly on Durkheim's ideas that come from social integration. And the best modern interpretation of Durkheimian sort of thinking about social context and integration is Bernice Pescasolido's work on mental health and social isolation. And the idea here is that communities are constructed not from an individual's engaging in a belief structure, but because individuals engage with each other in a pattern of distributed ties. And that pattern of distributed ties creates a community context where norms, beliefs, and values can circulate. And those norms, beliefs, and values create a context in which people who have mental health problems are supported and cared for, or otherwise, sort of dealt with. And this idea of how the community structure influences the cultural structure of this set, that linkage between culture and structure, was built first in Durkheim's notion of integration and is taken up in health by people like Bernice. Bernice now runs the Network Institute at IUNI, the Indiana University Network Institute. They're a competitor of ours. We hate them. No, they're wonderful, wonderful people. And Bernice has been to this workshop many times. And I encourage you, if you want to think about the mental health side of social networks and health, this is the touchstone to start with. The HIV work took on a modeling direction, again, with some of Martina Morris's work on concurrency. Largely before this, not because people didn't know better, but because people didn't have any better data and sort of thought it would be good enough, almost all data were collected cross-sectionally, and the timing was ignored. And so you think about something like the risk for a disease flow, I'd say, well, how big is the network? The network's big. There's a lot of risk. It turns out that it's not that simple. There are some issues about the connectivity, the timing of relations that can really constrain the ways in which disease flow. The intuition here is that I can't ever, that sort of my past sexual partners aren't at risk to the diseases my future sexual partners give me, right? So that is my current partners, future partners are of no concern to me other than the heartbreak that must imply that my partner is going to have future partners, right? So that part is bad. But from a disease standpoint, I can't do anything about it, right? Your mother told you this, right? You've slept with everybody your partner's ever slept with, right? That idea is built into the notion of concurrency. And it turns out that this is a really fascinating mathematical problem about the ways in which the timing of relations can constrain disease flow. And it has lots of implications about things like frequency of contact. And this is true both for sexual networks as it is for communication networks. In a world where like Twitter or Facebook or someplace where you have broadcast communications, timing matters much less than in a place where you have gossip, right? Gossip has to move through sort of small circles at the well, right? And so some of those Susan Watkins' work on gossip would suggest that there's a timing effect of when you know something and how when you know something, and the frequency with which you up your information solidifies the understanding of a cultural milieu. All right. This modeling took up some more stuff, like Anderson and May's piece. How many epidemiologists in the room? Right, how many of you have this book on your shelf? Yeah, see, I mean, this is the kind, if you're a social network person that grew up when I did, you have the big red book from Wasserman and Faust on your desk. If you're an epidemiologist from the same period, you have this one on your desk, right? This is the touchstone piece for the mathematical modeling of networks, right? And in Bauman's work on peers and smoking, this was essentially pre-ad health. Like Susan Ennett's stuff is the stuff that sparked the idea for how we would collect ad health and the data that was done there. Susan Ennett at UNC and Carl Bauman have been doing this work for longer than they would care to admit, and it's really, really fundamental. Susan Ennett has now gone on to do some really fascinating work on negative ties, which is another area that has been neglected in social network, in the history of social network research. Provon and Millard. This name might be a little bit less familiar to those of us that are modeling individuals' health, but this is one of the first touchstone pieces for organizational models of health. And you want to think about organizational health systems and the ways in which a health system might constrain the ways in which health provision is given. Provon and Miller's work is some of the first one. And it's really thinking about some ideas that came out of network ecology in the organizational behavior fields and applying it to health delivery systems. And it's raised a bunch of really interesting questions that have happened since about what's the most efficient ways from a network standpoint to organize health systems. And here the idea, of course, is that there's always a trade-off between efficiency and robustness. That I can organize a health system to be incredibly efficient, but also incredibly fragile. And so if you want to think about the ways in which you organize a health system and the way health systems are organized in general, there's a balance and a trade-off between this efficiency and robustness that is not trivial. And coming up with a way to model that is something that's of deep interest. Tom Valente, like I said, is the inheritor of Roger's work on the diffusions of innovations. Tom Valente is arguably one of the leading people in our field. He literally wrote the book, Social Networks and Health. The bastard got the title before we could. And he's really just been driving the way in which this field goes, right? And he's done it in two important ways. One is he's provided a nice set of software and analysis tools for doing the network version of Roger's ideas about the diffusion of innovations. That is, you can do it not just at the aggregate level, but you can do it on real, extant network ties. And that's really important if you want to understand the flow of something through a network. Bless you. The other thing that he's done, probably more than anyone else, is he's generated these notions of network interventions, right? So he's flipped the script as opposed to all of us who sit behind the desk and say, this is what you do in order to understand a network. He says, this is what you do in order to change a network, right? In order to introduce an innovation and an influence in a population, he'll identify key leaders or key places in the network where if I change those people's behaviors, it actually affects the system as a whole. And he's provided a whole series of tools for doing this. He's also probably rejected every one of your papers you've submitted to social networks, try not to hold it against him. He's actually a very nice guy. Ad Health was released in 1996. The data were collected first in 1994. You heard more about this afternoon than you care to know about, but it really has been a landmark study in multiple network analysis. And one of the reasons that I bring it up here is not just because many of you might be using Ad Health, but because this idea that networks are something that we calculate in the plural and understand in the plural would have been crazy 30 years ago, right? So the idea that I have 121 separate school networks, that's awesome, right? Because instead, what you have is a case study. And case studies are great. I love case studies. You can learn a lot from a case study, but an N of 1 is always an N of 1. And if you have one network and you have a process observed in one network, you have no idea whether or not that's a little snowflake that is all by itself or whether it's something that's general. And the beauty of studies like AdHealth, or the Honduran village studies, or the study that's like 4 village studies going on in India right now, these are studies where you have multiple instances of the same network, and thus you can look at these contextual effects in the ways that we were only able to before to look at something like neighborhood effects. It raises incredibly difficult questions both from IRB and from cost, but if you can do them, right, the rewards can be really, really, really dramatic. Carl Latkin is sort of the other branch of the May and Bennett and sort of the social influence model coming out of social networks. Carl has had probably one of the best histories of producing students that have been done just dramatic work in this field. His work covers everything from HIV to injection drugs to smoking and adolescent behavior. It's just a wide array of studies. Clearly one of the leaders in the field, and his work was sort of key in the early and late 90s. Coming out of the concurrency work and the HIV work and the Project 90 work was the development of this notion of statistical models of social networks. And StatNet was released about this time. This is probably the second piece of this. The original precursors to this came out in the 70s with Holland and Linhart. But it really sort of took its own when the computational turn happened in the early 2000s, where we actually got the computational acumen to be able to do these kinds of models appropriately. They're really hard to fit, right, because there's a lot of computational effort that's gone there, but it is important. And this has sparked a new way of thinking about networks. Prior to the statistical turn in network analysis was largely a descriptive comparatives process. I would take a network, run a model on it, sort of describe what it looked like, and tell you a story about what that looked like. Now what I do is I run a model on it, get a test statistic to say whether or not my story is a bunch of bullshit or not, right? And so the idea is you can think about these studies with a kind of rigor that we couldn't think about them before. And that really has changed the way we think about networks. And it's sort of erased a little bit some of that Barton critique we have about the statistical modeling of social behavior, that the beauty of being able to think about networks within a statistical frame is that we can situate what used to be thought of as an unanalyzable statistical or numerical object into a statistical frame and a comparative framework, which is quite nice. And some crazy guy wrote a paper on adolescence. I don't think about that. There's been a lot of work about race disparities that comes out of health and social networks. A lot of the interests that come out of the disparities, the health disparities literature, can be thought of as community processes on networks, right? And so if you think about something as simple as the differences in HIV between blacks and whites in American adolescence, it's a real mystery where that comes from when you look at the individual level, because individual black students and white students tend to have roughly similar sexual activity levels, right? They don't differ that much. But once you realize that there's homophily in who people have sex with, and that African American communities are simply smaller, just numerically fewer African Americans than there are, that means the density within those networks are higher, and the likelihood for a spread within that set is going to be higher given the same focal contact activity. So that is, I can explain a health disparity that on the outside is unexplainable at the individual level once I understand that at the community level, the mixing creates differences in density and thus differences in the spread potential of the network. The piece that probably created the biggest both push and pushback in networks, probably in history, is Christakis' and Fowler's paper on the spread of obesity in a large social network over 32 years, or as all of us refer to it, the Your Friends Make You Fat paper. Right? So the Friends Make You Fat paper pissed every economist off in the country. They just could not believe this idea that it was possible that people you go to dinner with might say, here, have another shrimp, right? And so apparently economists don't get offered to go to dinner very often. But the problem, of course, is that this was by publishing this paper in the New England Journal of Medicine, right? You're really taking an idea to a place where this idea just didn't fly, and certainly wasn't going to fly simply. You had to have the empirical and, quite frankly, fortitude, the personal fortitude to stand up in front of the kind of withering attacks that this paper received. And frankly, they might have got a few things wrong in the margins, but the main story seems to hold despite a bazillion sort of arrows tossed at it. And the main problem with the study, from an econometric standpoint, is that we're talking about the spread of something in a field that's really hard to trace empirically, right? And so there's always a hidden process underneath a social network effect, which is that we talk with each other, we hang out with each other. If it's a social behavior, at the end of the day, the individual changes their mind or changes their behavior or does something. And I can't always attribute directly to Craig's behavior my change of behavior, right? And so the fact that we can find that association over and over and over again, and yet at the end of the day, the individual's making a choice or making a behavior change, always opens the door for this critique that, well, the behavior change would have happened anyway. And this is the problem of selection and influence. That deep in the idea of the behavior side of things, there's the likelihood that there's something selected me into a network and a behavior simultaneously, and it's really hard to tease those out. It turns out that there's some pretty good plausibility tests we can do. And those plausibility tests make it possible for us to distinguish what's likely the case versus what's possibly the case. And we need not be completely afraid of the selection boogeyman under the bed. There's been a lot of this work sort of coming out of the Christakis and Fowler's idea, but the same thing that happened about this time, this confluence of ideas, is the rise of social media and the internet writ large, right? And so it's not accidental that in the mid-2000s, when people started thinking about networks, I know I could go into schools and talk about networks and people actually knew what they were, right? And so now I've gotten to the point where you talk about networks, you have to say, no, it's not just Twitter, right? There are other networks in the world. People used to talk to people face-to-face before they tweeted them. But this is really both a fear and an opportunity, right? So the thing about Facebook and Twitter and Instagram and the rest of the social media sites is that it opens a remarkable trove of data for us as analysts to play with, right? So there's opportunity to think about networks in a context that is much broader than we've had before and much less restricted than the idea of having to go into a school or a government building or a village or some other sort of fairly finitely defined space for the luxury of having a nicely bounded population. The beauty of Facebook is it's in the wild, right? We get it for the entire world, right? That's awesome. But the problem is we don't know if any of those relationships are real, right? And so there's this trade-off, right, between the depth of the relationships that we engage in these kinds of activities, right? Is social media a broadcast medium or is it actually an interaction set, right? These kinds of features are really deep questions that we haven't worked out. One of the beauties, though, is that in some sense the mechanisms are still unclear, but the proof pudding has already been produced, right? If you look at some of the work that Fowler has done that shows spillover effects in voting behavior, spillover effects in networks for health, Sinan Aral's work showing that that my exercise is contingent upon the Fitbit friends that I have that I exercise with, right? These are really careful studies done with very nice instrumental variable designs that allow you to really parse out the distinction between what's going on with the other person and what's going on with my own selection and my own influence. Shows that these kinds of networks, these big global connectivity sets, can have a powerful influence precisely because they reach so many people simultaneously that even a small change in behavior can have huge multiplier effects. And the ability for us as analysts and hopefully as policy makers, right, and for people doing intervention science, might have an opportunity to just move the lever a little bit in these large-scale systems can have a huge impact for the society as a whole. And that's, I think, the real promise of these kinds of work, even though that work hasn't been fully fleshed out mechanistically yet. And again, recently, Social Networks in Health, this is Tom Valente's book. I highly recommend you buy it. I don't get a cut, though maybe we should. Now I could continue. You'll notice that was 2010, right? So there's been 10 years of work since Valente's book, and the curve does look something like this, which is kind of amazing. I keep waiting for it to start dipping down, but for some reason it keeps going, and that's great. But I'm not going to go through this kind of timeline for this kind of growth rate. We would be here all day. So I'm going to play another little trick, a trick very similar to what Alex was talking about this morning. Is Alex still here? You might have had to fly home. So you can think about networks. This is a joke my students know already, is that I turn everything into a network, just to give us fair warning, right? So in this case, we can think of the nodes of the network as papers, and the connections between two papers is how similar they are in the set of words they use. So here we have a paper of the analysis of the human papillomatosis virus vaccine debate on MySpace blogs. It's a very general paper. I'm sure you all read it. It was brilliant. This paper is pretty similar to a set of papers talking about the environment, a set of papers about the association between exposure and negative opinions on HPV, a set of papers about if it doesn't kill you to quit smoking. All right, so a whole series of different things that this paper is close to. Right, it turns out that this paper bridges a set of different topics. Right, that's lucky me. I picked randomly. I make most of these data up, so I didn't pick anything randomly. So this paper bridges one paper on health blogs, another on smoking, another set on Twitter, and so forth. So you can think about a literature, right, as the set of papers that are clustered together about various things, right? And if you think about what that looks like in general, this is the 20,000 some odd papers published since 2000 on social networks and health. And so there's a huge set of things that people writing about social networks and health write about. And what these kind of models allow us to do is to build an intellectual landscape. And that intellectual landscape provides us a way of summarizing the research, which is a little bit sort of perhaps, this is the 30,000 foot view, interesting than me just sort of giving you my highlight reel. We can think about each of these topics, so that's the example paper we just showed in the set. This landscape is really a set of clusters, right? These are a set of topics or clusters that people are writing about, and they're near each other if they're talking about the same kinds of things, right? And so in this case, right, we have health systems policy. This is the people dealing with things about the best way to generate health and health pieces. HIV is pretty obvious, adolescence, social support and aging. Social media is kind of bridging lots of these pieces. I've labeled this one cancer at the top here. This is really sort of wet health, right? So this is stuff that's going on in the body up here. That's, to a sociologist, it all looks like cancer. And so those are the clusters. And then I want to give you a sense of where those touchstones fit across this intellectual landscape, right? So the importance of Rogers' diffusion of innovation is that it's cited everywhere, right? So if you're working on cancer, you're likely to be citing Rogers' diffusion of innovations, but also if you're working on HIV or influenza or health systems, right? So this kind of work on the diffusion of innovations is ubiquitous across the entire intellectual landscape. Same thing with methods, right? So this is Wasserman and Faust's work, right? So this is the big red Bible that many of us have on our shelves, right? Valente's work on lots of different things, right? Christakis and Fowler, cited everywhere, not so much in health policy research, right? Martina Morris, she's studied over concurrency as a proportion largely for HIV, a little bit in adolescence, a little bit in social support, right? The RDS work happens mainly in the HIV work. House is social support and social relations is up here. Provon is over here in the health systems, right? Ad health is here, right? So a way of thinking about the ubiquity and the cross-cutting notions in which these topics get used is that this is just my way to try to highlight the extent to which these pieces have been influential. Something like Ellison's work on Facebook, of course, is all around the social media set. Now, what's nice about this kind of work is that you can think about it not just in terms of particular authors, but in ways in which particular topics cross-cut this field. And this is part of what I think is so fascinating, is that we can think about something like health disparities by race. That's important everywhere, right? Whereas gender appears to be largely on the personal health side, not so much on the systems health side, right? So the distinction between the fact that race covers a health policy system is that we really do have some very strong concerns, historical concerns about health delivery amongst different populations that appears not to have been studied as often anyway as gender has across these settings. And we can think about that in terms of specific diseases, right? So if we're thinking about BMI or diabetes or hypertension, right? These are spread across different pieces as well. And all of this is just a way for me to say that this is a vast field. And there's no way we in this week can cover it all. But I hope you, as readers, go out and realize that there's lots of these key touchstone tools that are important. And once you understand those tools, it's going to open a door to read all this rest of this literature, and you're going to be at least, familiar with this broad swath of intellectual work. That's the 30,000-foot view of what the field looks like. The field is set up in a way, right, as it is, it's an emergent phenomenon of a bunch of scientists. This week is set up around a slightly different set of problems, which is we want to think about how you contribute to this field by how you generate a paper. And to generate a paper, you tend to start with a research idea, you get some data, you explore that data, you model that data, you get some results, and then you realize you were wrong, you go back to the beginning, and you start over again, right? This is the thing that graduate students just hate because many of them just learn that this is true. And this week largely follows that idea. So what we're going to do in the course of this week is map on a series of lectures and labs and so forth that take us through this. I'm going to show you how that works towards the end. But first, I want to give us some basic elements of network science so we have a common language to think with going forward. All right, that was a sprint. You with me? Questions, comments, thoughts, concerns? Awesome. Okay. So I want to think about what networks are, right? So we've seen now that it's ubiquitous across the health sciences. What, in fact, are we talking about when we talk about these notions of networks? Well, I like to think about networks in two different ways. One is this notion of networks as variables approach, and the other is networks as structures. Networks as variables tends to be measurements on networks, metrics, centrality, cohesion, something like this. Networks as structures is the idea of thinking about the system as a whole, what generates hierarchy, whether or not the system is segregated versus integrated. I also prefer to think about networks as a distinction between a connectionist approach to networks and a positional approach to networks. The connectionist approach to networks is best thought of as networks as pipes. The positional approach is networks as roles. I'm going to give you some examples of these as we go through. If you take this notion of connectionist versus positional, cross-classify it by independent or dependent variable, just to be crude, right? You get lots of different ways of thinking about social network analysis, and this is kind of the things that we're seeing across that whole wide space. If I'm interested in how networks might spread a new idea, the diffusion of innovation is right here. Whereas instead, if I'm interested in why rich hospitals only cater to white patients, right, that's a sort of a network as a result output that has to do with the position of that network in an economic field of other possible relations. We'll get to that in a minute. Let's start with the connectionist idea, right? So the networks of pipes matter because something flows through the network. This is the simplest way of thinking about networks. This is the idea that most of us already have as networks, that if I tell a secret to somebody, they tell a secret to somebody else, and they tell a secret to somebody else, before you know it, everyone in the office knows that I'm dating somebody else, right? So this is the idea that networks as pipes go, that you can't keep a secret in a sorority. I actually have data on who tells secrets in a sorority, and it turns out that it's one big connected loop, and there's a reason that everybody knows everything that's going on in the sorority. For our purposes, when we think about health, right, we can think about the basic epidemiological equation, which is this idea of a reproductive rate. When something spreads in a network, if R naught is greater than 1, that means for each index case, you get more and more secondary cases. And that's a function of the duration of contact, beta, the likelihood of contact, C, and the duration of infectiousness. That's how long is the bug going to keep biting you, which is D. And for most cases, this contact parameter up here is something that we don't care too much about. It's a random mixing. Again, if I sneeze on the airplane, everybody gets it. If you got that coughing baby behind you, you know that you're going to get it all the way through, right? In the social network world, the idea is that contact really matters. And contact matters to sort of inverse to the virulence of the pathogen, right? Things that are spread really easy, the contact pattern doesn't matter much. If contact matters a lot, right? If it's really hard to pass the good along, right, then contact matters. Give you an example. This is my favorite example. Imagine you're cared about something like STDs or HIV, and I ask a set of kids about who they have sex with. These are adolescents, right? So each adolescent has 2 partners, right? And so these 2 partners, this person says that I have 2 partners. We might ask them whether they used a condom, how often you had sex, what kind of sex you had, lots of invasive questions that they might not want to answer. But at the end of the day, structurally, they all look the same, right? But if you then layer them over the contact pattern of the rest of the kids in the high school who've also had social relations, right, then you can know that some of these kids, right, who've had 2 partners are connected to 288 other kids who also had partners, whereas some are not. These are real data. These are also from AdHealth. Right, so this is one school in the Midwest. This is the parent's nightmare, right? You think little Johnny's behaving himself and is a great kid, right? He's only had 1 partner in high school, but that partner's had a partner who's connected to everyone else in the school, right? Now, it's not as bad as you might think, right? Because this is a collapsed time version of something that's actually unfolding over a course of 6 months. But even in 6 months, it's not that great. Right? So this is the kind of thing you want to worry about. But the point for us is that if you have a general isolationist view, where what you care about is the sex act and what's occurring in that act and what those people are doing at that time, right, you're not going to get much compared to what you can get with this, right? That's because what matters most for your risk is not what you're doing in the relationship, but who you're doing that relationship with and who they're doing that relationship with, right? And so the spread of an infection depends entirely on the connectedness set of the piece. And if you've lost that connectivity, if you don't understand what that structure looks like, you're going to do a miserable job of predicting the outcome. And part of the reason that the number of sexual partners is such a poor predictor of HIV and STD status is precisely because of this. Because I could have 1,000 partners, right, if we're isolated on an island, not the smoking island, another one, off in the middle of some island someplace somewhere. If there's no chance of us getting connected to the rest of the world, there's no problem, right? But as soon as you connect it to everyone else, there's an issue. And it turns out there are lots of interesting questions about connectivity that you might not otherwise think about. So for example, I can think about this number of partnership distribution, and I might say that a person has on average, something like 1.7 partners. You can't read that, it says 1.68. Most people have 1 or 2 partners, a few people have 3. The overall network structure in this set is a lot of little disconnected components. If I increase a little bit more, a little bit more, and a little bit more, I can move from 1.7 to 1.9, and I get a difference between being completely disconnected to a world that's completely connected. Right? This is a 0.2 increase in the number of average partners per person in the population. It's undetectable from a statistical sampling standpoint. It would be within the sampling error of most small samples, but it makes a huge difference. This is because I've happened to pick these values right at what's known as the phase transition. And social networks have this feature, which is that nothing can happen for a long sort of piece. Then you reach this one element, and a small change cascades into massive connectivity. Right? So the phase transition in connectivity and networks is a fundamental feature that we're going to go over later. But it's one of these pieces that you might not appreciate, which is that this level of connectivity occurs not because 90% of the people change their behavior. The vast majority of people are still doing what they're doing over here, having the same small number of partners, but a small switch at the individual level, a small proportion of individuals changing their behavior can have a massive shift on the population level. And that's this idea that Durkheim and Moreno and the rest of these folks were talking about, that there's a system level feature here that's independent of the individual level feature, and that system level feature is what you need to have the data for the whole thing in order to understand. Because if I only have the individuals, I don't have the ability to see that this entire set goes through. So that's the connectionist approach. The positional approach is a little bit different. For sociologists and anthropologists, this is pretty familiar. For public health folks, it might not be as familiar, right? So I'll give you an example that should hopefully resonate, which is imagine I have 5 people, right? 2 of those people love each other, and they feed 3 people who fight with each other. Any idea what this might be? The parents are laughing. They know what this is, right? So this is what a sort of an archetypical like sitcom family looks like, right? And we know this not because I told you who the parents were, but because I told you the relations. And that's because roles follow exchange. Parents feed kids. Parents love each other in a very different way than they love their kids, right? Kids, they might love each other, but they bicker, right? Cops chase robbers. Robbers don't chase cops, right? Bankers loan to lenders or to borrowers, right? So leaders, followers, lenders, borrowers, parents, children. These are all roles defined fundamentally by exchanges. And an exchange is a network, right? So if I'm doing one thing to you that's different than I do to someone else, then that difference in how we relate is a difference in our network patterns. And that difference in network patterns categorizes and captures the social roles that we inhabit, and those social roles capture the constraints and behaviors that we're engaged in writ large, right? So if I can understand from the world, right, what these relationships are in any given setting, I might be able to figure out that these kinds of positions carry with them certain kinds of health risks. And what's beautiful about the network approach to roles is I don't need to go in theory, I'm pushing the analogy, but in theory, I don't need to go into the setting and spend my entire life talking to a handful of people to try to get a deep understanding of the cultural context. Instead, I can map the pattern of relations, and from the pattern I observe, identify people who are doing the same thing, right? And by virtue of the fact that they're doing the same thing with lots of other people, I can pretty much infer that they occupy the same role, even if they're not aware of it. That's the cool thing, right? I can figure out that these people are engaged in the way they use sex and drugs and money at the same time, right, is different than somebody that only uses sex or only uses drugs or only uses money. And that distinction in the way I engage with the world probably shapes my risk patterns writ large for health and health behavior. All right, so those are the 2 big pictures. The data elements we're going to deal with, and I'm going to go over these fairly quickly. are as follows. So the basic network data that we deal with are two data sets that are linked, right? The key element would be the actors, right? So the first set are the actors, which are referred to as nodes or vertices or points, and the relations. And these are two separate data sets, if you will, but they're linked. The nodes data set is a data set that you already know how to analyze, right? This is the individual, their attributes, their behaviors. It's just a rectangular data set, a series of rows, a series of columns for everything I care about, right? The relations, on the other hand, are pairs, the relations as a set of data are pairs of other sets, and I'll show you an example of that. Relations come in some different kinds of flavors, right? So I can have a binary network. A binary director is either on or off, right? And so if it's on, so we either had sex or we didn't, right? If you grew up in a traditional sort of fundamentalist Christian church, you might try to fuzz that line, right? But the honest truth is sex is binary. You either had it or you didn't, and it's undirected. If I had sex with you, you had sex with me, right? If we're in the room together, right, so that's a binary outcome. So I'm in the room with you, you must, by definition, be in the room with me. A directed relationship is one where I send something to you, and you may or may not send it to me, right? So if I hit Craig, right, he may or may not hit me back. He probably wouldn't. He's a nice guy, right? I wouldn't hit him if I could help it. But the notion of hitting, right, is a directed relation. It's possible to conceive of it as not being the same way. This is common for most of the survey data we have. So if I say, who is your friend, I can say that someone's my friend, and they may or may not say that they're my friend in return. Right? And so that's a directed relation. Directed relations carry lots of information about status differences. Right? So if I like you, but you don't like me, you're probably cooler than I am. Right? And so there are lots of folks out there that are cooler than me, and so I have a lot more outgoing ties than I have incoming ties. Right? That's a distinction of hierarchy. Relationships can also be valued, right? So it can be the number of committees we've been on together, right? So if I've been on a bunch of PhD committees with the same people, right, then they've also been on those PhD committees with me, right, and we're probably in the same discipline. Whereas if I've been on one committee with you, then it's a weaker tie than it might otherwise be. We might relate this in various and sundry ways. The common ways to put a number above it or have a thickness of a line or something. Right? And of course, you can have a directed value tie. It could be that I like you a lot and you like me a little, right? This is the classic unrequited love feature. Like I like you a whole lot, and you like sort of tolerate me. That's what movies are made of. But this notion of a value tie, right, gets us past this idea that we have to think of things either friend or not. We can distinguish the amount of time and energy and effort put into these things. It's important to note as well that relations need not be unitary in their meaning. Right? We can layer relations over the same set of nodes. These are called the multiplex relations. So multiplex relations are relations where we have the possibility to have liking and exchange of respect and exchange of enmity or what have you. If you can characterize your social system as a series of relations, you can then stack those relations to identify roles. Right? Is this all clear? Sensible? Okay, awesome. So once you have the basic data structure, now we need to sort of expand our understanding of the different levels in which we might think about data, right? So we can think about data at the local level, the ego network, the partial network, the global network, or the total network, and it's easier if you have a picture. Right? So at the lowest possible level, you have a best friend dyad, or some kind of a dyad. So this is, there's been a million sort of social psychology dissertations written on the best friend dyad. So do I have a friend that I can confide in? Do I have a friend I can tell a secret to? Right, so the single best friend might be one element. From that, we might blow up to what's called the ego network, or a one-step ego network in this case. An ego network is characterized by the fact that it's always centered on an ego. Right? So in this case, we have this node. If you go one step in all directions, that's the ego network. When we speak lazily, we just call it the ego network. Technically, this is a one-step ego network. You could have a two-step ego network. You could have a three-step ego network. By the time you get to a three-step network, you may as well save yourself the trouble and do the global network. But the idea is that what makes it an ego network is that it's centered on a particular node. Right? There's also something you might think of as a primary group or community. Right? A primary group or a community are the sets of nodes that I spend most of my time with. Right? And so all of these folks spend lots of times with each other, right? Even though some of them might have ties that go outside the group. Like I spend a lot of time with social networks people, but I have a few political theorists that I hang out with too. Right? Don't tell my social networks friends. But the idea is that the primary group need not be your ego network. Right? They might be. Like so, for this node, this node's ego network is completely within the primary community. That's not necessarily the case. I call partial network as a catch-all term for I didn't get it all, right? And in reality, almost all of our networks are actually partial networks because social life is never as bounded as we'd like to think it is. There are a few contexts where it is true that it's highly bounded. So if I want to look at social relations among Supreme Court justices, I'm blessed with the fact that there aren't that many Supreme Court justices, right? And so I know exactly who they are, and I can look at all their relations, and I know what they're doing, right? If I really care about adolescents as my analytic sample, if that's the people that I care about logically, right, my operationalization of that is schools. Why? Because schools are easy to capture, right? There's probably a lot of kids who have friends outside of school, right, or within a different school, or there might be kids that dropped out of school entirely, right? They're in my analytic sample. They're in my notional sample of what it means to be in an adolescent network, but they're not going to be in my operational sample. So this notion of a partial network is just recognizing the fact that we rarely capture it all. The single best way, or the most common way that people get partial networks are from linked trace designs. And RDS is the most common version of this, but any kind of snowball sample will take you to a partial network. The problem with a partial network design, problem's the wrong word. The limitation, that sounds like a problem. The feature, I don't know, the one characteristic of a snowball sample or a partial network is you almost never get the isolates or the outside folks, right? So by virtue of starting with a node and snowballing out to the set, you're conditioning your sample on the fact that people have relations to the people you started with. And so you almost never get the real isolates in a social system from something like an RDS. Now, in most cases, that's okay because the relation is a weak one. Do I know somebody? I don't have to be a close friend with them. And so there aren't that many people that are truly isolated on these kind of weak relations, but that is a feature of the sampling strategy. A global network is a frame where you've identified the set of nodes ex ante, right? So I know which set of nodes I'm interested in studying. I have some boundary around them, and I ask about relations amongst them, and then it's quite likely you're going to get isolates, right? So from the global network standpoint, it might be that nobody likes to hang out with a particular Supreme Court justice after work, and so by virtue of that, like I know who they all are, and then he or she might still be isolated, right? The person who never is elected department chair, like they'll still be there, right? You just won't have any relations on them. So those are the two dimensions that we've gone through of network data thus far. So we've gone through directed, binary, valued multiplex. So that's the kind that characterizes the kind of relations. The second dimension on which to think about network data are these levels, right? So from local to global. The third dimension to think about is what we call the number of modes in the data. Right? So the most common data that you're going to think about are what we call one-mode data. These are relations where essentially there's no fundamental distinction amongst the nodes. Right? That is, it is in theory possible for any one of the nodes to be related to any of the other nodes. Right? So any kid in this high school could, in theory, be friends with any other kid in this network. Right? There's no logical constraint against doing that. There's a social constraint in this particular network between white kids and black kids being friends, but there's no logical constraint against it. On the other hand, a two-mode network is when you have some logical distinction between the classes of nodes in the network such that it's only possible to get relations across the nodes as opposed to within the nodes. The most classic example of this is authors and papers. Right? So papers can't be connected directly to each other, but they can be connected to authors, and each author can have multiple papers. Right? So authors are connected to each other, not because they're directly, like I don't write Peter Muka, right? Peter and I are connected by the fact that we share a paper that we both wrote. Right? Some bad jokes I could go into, but I won't. So you can think of people as members of groups, people as authors on papers, words written by people, events in the history of a person, right? These are two-mode networks. And the reason I bring this up is that these data are the easiest data to collect, right? And so it's really hard for all the IRB reasons and everything else we've talked about to collect data on the one-mode networks of things you might really care about. Say, if I want to know who's doing drugs with who, that's really hard to questions to ask. There's lots of issues with that. But I could ask people, where did you last do drugs? Right? Where did you get your drugs? Where do you dispose of your needles when you're done with them? Right? How often do you meet people at these particular venues? And by building a whole series of venues that drug users are engaged in, I can identify sets of drug users that are linked by sharing the same venue multiple times. Odds are really good in a rural setting that they know each other, right? So without having to go through and actually literally identify who's connected to who and asking for that disclosive information, I can ask for information that's much less sensitive, but nonetheless in aggregate creates portraits of the social system that can be useful. Right? This is a classic example of this. This is the Southern women's data, right? So here you have a bunch of women this is like the 1910s, if I remember right, who went to a series of lunches in Charleston, South Carolina. This is what women in the 1910s in Charleston, South Carolina did. And so you can see there's the distinctions, right? And what's interesting about this is that there are some women, like Charlotte, who never go to lunch with Flora, right? Might be a problem there, right? So you can think about how this works, and you have a certain set of events in which some people, like Flora, is over on one side and Charlotte's on the other. By and large, the Southern women are largely connected to each other, but there's some clear exclusions in this set. And you can think about these kind of communities without ever having to ask them, who do you like? And if you think this is not relevant, this is data from David Van Duyn that Dana and I are working with to map spread of antibiotic-resistant diseases across patients, patients linked through hospitals, right? So each node in this case is a hospital, and if you've been at one hospital or another, then they're linked by shared patients. So that's a classic two-mode data set, and if I were an epidemiologist interested in figuring out where to investigate the spread of diseases, I might start with these hubs. Right? It's the kind of natural thing you can do. You can also think about how patients are shared across physicians. Within most hospitals, we've discovered that almost all hospitals have multiple referral networks inside the hospital. And so if you think that the hospital is a binary unit, that's the thing that where healthcare is given, in fact, you're wrong. And the hospital readmission rates can vary as much as 20% between the two communities within the same hospital, right? And as a patient, you have no idea whether you've got assigned to the good community or the bad one, right? And so this is the kind of thing that as an administrator you might want to know, right? But, and with US News Report and all the other places are going to rank the hospital as a whole, and that whole ranking is going to be the average of the really crappy community and the really good one. And so it'd be nice to know which was good and which one is crappy. All right. Are you going to go over this kind of pieces? Adjacency matrices, or should I? Are you sure? We're going to do that tomorrow. So worth hearing it twice. Where are we on time? 3:10. All right. So this is I can't stop myself. There's a. I told you, right? We store data. We don't actually store data. This is why I'm concerned rather than give this. Intellectually, the way to think about a network is not as a picture, right? I love pictures. I spend a lot of time dealing with them. You can't analyze a picture. You have to analyze a data object. And the data object that we typically think about is a matrix. And this is known as the adjacency matrix. An adjacency matrix is a double array of both nodes down the row and across the column and the content in the middle of the relation between them. So for a binary symmetric network, you would have a symmetric matrix, right? So if B is connected to A is also connected to B. You're going to see a lot of these adjacency matrices, and Maria's going to go over them tomorrow, so I'm not going to go over them in detail. But the beauty of these kind of matrices is once you have them, right, you can add all the information you want to in that matrix. Now the problem with the matrix is that it's really like cumbersome. Like you can't have a million node matrix. You don't have a computer to store it. So instead, what we do is we create these things called these different types of data structures, like an adjacency list or an arc list. And an adjacency list is a survey response data set. So this is the kind of data set that all of the Stata users in the room are used to, right? So we have respondents down the row. My first friend, my second friend, my third friend is the columns, right? And so that's all this is, right? I've just not listed the missing variables, right, for the relations that aren't there. The beauty of an adjacency list is that all of the software packages you already know how to use, take it, right? And so it works quite nicely. The difficulty with the adjacency list is that there's an implicit order about the relations, and so I can tell that A is connected to B, but if I also want to know that B is a white, balding male with a bad beard, then I need 4 other columns over here that are in the right order, right? And so keeping track of that can be kind of a pain in the butt. And so another way to deal with these kinds of data is something called an arc list or an edge list. The beauty of an arc list is that I can have every relation is the unit of analysis. So now I have as many rows in the data set as I have non-zero elements in my matrix, right? And I can characterize the values or features of this matrix of this adjacency list just as another element, right? So I can tell you how frequently we interact, how much you love each other, whatever we want as a separate variable. The data management becomes much simpler, right? Also, I can list this for multiple types of relations. So A and B could have one type, which is love, A and B another, which is fight, A and B, which is feed, right? You can have another relationship for each type of piece you want without having to stack them up over and over again. Now the good news is that all of this happens sort of behind the scenes, right? So when you load a network object in R, Right? You're not going to ever know if it's held as an arc list or an edge list or an adjacency list. It's going to do what it needs to do to make the most efficient use of the underlying algorithm. But it's nice to think about it in your own heads about as an adjacency matrix, because adjacency matrices, like all matrices, can be subject to matrix algebra and other kinds of mathematical operations that allow you to do things on networks that have substantive meaning. And we'll be going through a bunch of those operations when we get to the descriptive statistics set. All right, so I'm not going to talk about that one. Questions, comments, thoughts, concerns on basic network operations, data, elements, types. That's the world's fastest introduction. Please.
This might be addressed later, but I'm curious, is there a best way of sampling to make sure that you get the most important nodes?
No. So the best way of sampling to make sure you get it is to do a census. And for the vast majority of the history of social network analysis, the assumption was that you had a census of the population. So this is the, network. We get sort of all high and mighty as network analysts about how we don't think we give up on independence and we have all this interconnection stuff. But the cost of that is that you got to do a census of your population, and it's really hard to sample. It turns out that there are new ways of sampling. So you can do simple random sampling, actually, of ego networks anyway. And with a high enough density of simple random sampling within an ego network set, you can infer the global network structure. But otherwise, I think that the first best choice is a census of a bounded population. The second best choice is what's known as what I would call network sampling with memory, which is a process developed by Ted Mao, which is a link tracing design, which is like RDS, but it's rather than being a wild, let the respondents drive it version of RDS, the investigator drives it, and it allows you to collect network data as you go. And the third version is simple random sampling on a dense simple random sampling. That is lots of observations from within the setting so that you likely get enough overlap to essentially to effectively do capture-recapture studies of your population. That's a really quick answer. Does that help?
Yeah. Can I have a follow-up question?
Yeah, absolutely.
So if you don't do a census, if you have some kind of simple random sample with partial population, does anyone ever use computation to figure out whether or not there's
Yes.
between those?
What we've done is, if you think of it, the beauty of thinking about this as an adjacency matrix is you can think of this as a maximum likelihood imputation problem, right? Where what I have are some cells where I know them to be zeros, some cells that I know them to be non-zero because I've collected those data, and some cells that are known to be NA. And if I know that, then I can take features of the rows, features of the columns, or features of the attributes of the rows and columns to infer the likely relationship on that set. And so there's a whole host now of tools for doing imputation of missing data based on either design imputed missing, so I deliberately leave certain things out, or observed missing, just happenstance missing. The real problem, and the formal answer is yes, it's possible. The practical answer is we almost always collect data on the presence of ties. We rarely collect data on the absence of ties. So most of the time, we assume that things that look like NAs, we assume them to be zeros. And so the imputation models fit best if you know the difference between a zero and a missing in your observed sample. This is why the ego network sample design is so nice. So if you start with an ego network sampling design where I ask the respondent about the relationships among the alters, I can then observe non-relationships. And I can code them explicitly as non-relationships as opposed to just missing reports of a relationship. And that then gives me some leverage for predicting that. Otherwise, I'm forced to always predict where a tie is versus where a tie is not, as opposed to adding that extra bit of information, which is I can know a tie to not be there from the characteristics of the attributes. Does that distinction make sense? Yeah, and Alex Wolfowski and Peter Hoff actually are two of the people here at Duke who've developed some of the best new methods for doing this kind of imputation. Someone else had a question I saw over here. Yes?
Yeah, so I'm pretty new to this, but I was just thinking, and it just occurred to me, I didn't even realize that we had data from an old project that was set up for this.
Found data is the best data.
So we have objective shift records of like who worked with whom, and it's nested by agency, but you could actually probably look at who didn't work with one another.
Awesome.
Right?
Absolutely.
It's objective.
I've been wanting somebody in the hospital for ages to give me shifts of nurses, because if you want to know where where sort of bacterial infections are moving, you want to know who's actually touching patients and moving from room to room. And exactly, right? And so if you know shifts, right, and this is like in my other hat, where as an economic sociologist, if you want to bust a union, you don't bust the union, you change people's shifts, right? You swamp agitators with non-agitators, and then you make them work different shifts, and they can't work with each other anymore, right? Or to flip it around, if you're a missionary, right, you don't send a missionary out by themselves into the world, they get converted. You send them out in pairs because they have someone to work with them, each other, and to reinforce their points of view. Right, so the whole point is that when you have ways of thinking about how people are co-located, it opens this whole vast array of data you didn't know you had at your exposure. And so the beauty of the Christakis and Fowler work, for example, is all the Framingham Hart data, that was not collected as network data. These were collected as data that said, if you die when we operate on you, right, who do I go to call, right? Who's your contact for backup? Who the person do I contact, right? If I can't find you for the next wave of the survey, like all of this survey administrative data was actually data that was social relational. And by having that social relational data, you're then able to build implicitly a network. And so this is why I say found data is the best data, because it's like there's no IRB problem with found data. You can do it, it's a lot easier to get it if it's already there. Now, the obvious problem is you can't determine 20 years later what the question was asked, right? You have to live with what you have. But exposure, just being in the same room together in multiple ways, or on committees together, whatever, is an incredibly powerful way to collect network data, or to analyze networks. More or less? All right. So, back to some pragmatics. This should look familiar. This is the day. We are here. This is where we are. We're a little bit off schedule. The plan today, why doesn't this thing work anymore? I busted the thing. Sorry to whoever has it next. There we go. Yeah, here it is. I wanted to just briefly go through what this week is going to look like, right? And so I want to think a little bit about this standard analysis diagram, right? This is the life cycle of a project. You start with this idea of a research question. This is what today has been really about. We want to help get the juices flowing to think about what a research question might be, right? To look at the research questions that have been done recently and to think about what those questions have and how we might build on them in interesting and valuable ways. Then once you, of course, you go through the beauty of thinking about a research question is you don't have to do anything concrete with it. If you actually want to do something concrete, you have to collect data and do data management. That's what happens in the next set, right? So we're going to talk about how you actually deal with these data objects, which is a non-trivial problem, right? And we're going to talk about what it really takes to collect the data, right? So the actual sort of surveys or data instruments that you might go through in order to get data from your mind into your population onto your computer to actually do an analysis is, of course, fundamental. And there's a couple different ways in which we can do this. We can do it, of course, with regular data. But we're also going to be able to do it with ego networks, which is coming over here. I should have highlighted that as well. Once you have your data, you want to do something with it, right? So you want to score it in various and sundry ways. And so you might have something like homophily or centrality or something like this on the network. Right, so these are a whole set of network descriptives that we're going to go through. And understanding how we do that, you might also just want to explore your data and figure out what's there, like look at some pretty pictures, see if there are communities there, see how it naturally divides into different types of roles. Right? There are lots of other kinds of exploratory elements that network analysis can be really valuable for. And one of the things that people don't appreciate often, especially when we get down in the weeds of things like ergoms and Siena models and what have you, is that there's a lot of power, especially to practitioners, to just see the network, right? So being able to do that and do that well, or be able to say, look, there are 100,000 kids in this school district, but it turns out that socially they break up into 4 different classes of kids. That can be really important and powerful. So don't discount exploratory analysis just because it's not causal, right? We also then have this whole host of time you're going to spend on modeling, in which you're going to spend more time with me than you care about. That we'll be talking about actually building the statistical tools necessary for analyzing these data. And then we'll do that both in the cross-section, which is largely going to happen on Thursday, and dynamically, which is going to happen on Friday. And then we're going to end by looking at our results and seeing what we've learned from the world. And for us, in this week, that's when Rich Rothenberg is going to come up and tell us about the history of the work that he's done in the field of social network analysis and health, largely in the STD and network epidemiology case. So that's the week. Now, if you're wondering what this little picture is, and if you downloaded the slides, you can see it in high resolution. This should be familiar, right? Because your name's on the screen. When you gave me the keywords That's a network, right? So those of you that registered gave me a bunch of keywords. That means I have a person by words, and some of you share words. And by sharing words, I can cluster you into a network, and some people share lots of words, other people share a few words. And if you notice on your name tag, there's a little dot. Those are people that you are in these clusters with, right? So your task over the course of this week is to figure out whether or not you actually share a word you wrote down or one that I translated, because I might have futzed the words a little bit to make the picture work. But the idea is that there is some commonality, right, because you share interest in social networks, health, and health topics. Question? Oh. All right. Thanks to the staff. We're going to take a quick break. There's coffee and donuts and fruit showing up.